Well, it's common thinking. I mean, I think it's common thinking. We should go to the doctor once a year, is what I'm trying to say, right? We should go to the doctor, even if you feel fine, at least get an exam.
And yet, we all know people who haven't seen a doctor in years. That really affects the preventative picture.
That's right. Dr. Katie Seguro is with OneWorld Community Health Center. Good to see you, doctor.
Hi,
Welcome.
nice to see you guys.
Yeah. So here's the deal. I've really been to the doctor every year. I make it a point to get there every year. However, I've skipped the last year, so I'm going on 2.5 years now.
Oh boy.
But what is it about, people that haven't been to the doctor in years? Why don't they get in?
Right. Well, I work at one of our satellite clinics, the West Omaha Clinic, and I've seen people who haven't been to the doctor for 30 years, 30 to 40 years.
Wow.
30
Sometimes
years?
people will say, I'll say, when is the last time you went to the doctor? They said, oh, when my kid was born, and the 25-year-old kid is sitting in the room.
Oh my.
Kid, in quotes.
Right.
So I think, people are worried about finances is the first thing.
Yeah.
People who don't have insurance, they're really concerned about that. Other people have insurance, or they realize we might have a sliding scale, but they're afraid of what they might find out at the doctor.
And then the fear of diagnosis. I've had relatives who they knew something wasn't right. Their intuition told them so, but they were afraid about what the verdict would be, and they just would rather bury their head in the sand.
Right, say maybe it'll just go away. Maybe the symptoms will just solve themselves.
Yeah, that happens a lot, and then we see people end up in the ER as a result of letting things go a little bit too long. So we really want to get people into the clinic before that happens.
So if you haven't been to the doctor in 25 years, you'd have to be behind on preventative care,
You
and then
are.
especially vaccines probably, right?
And a lot of people don't know that adults need vaccines. They think vaccines are just for kids. So one of the things I wanted to kind of talk about was vaccines that adults might need. The flu shot, obviously. Flu season's coming up.
I know one you're going to say.
What?
Shingles.
Shingles vaccine. That is something that we offer now at OneWorld. Walgreens and some pharmacies offer that as well. But if you've had shingles or you've seen anybody who's had shingles, it's a pretty bad thing to go through.
My mom had it. It was miserable. She still has some side effects from it. So yeah, you need to get that vaccine.
Yeah, so the shingles vaccine, the pneumonia vaccine, there's 2 pneumococcal vaccines, we call them now. And if you're a high-risk person, you might need it, or around 65, everybody should get one of those as well.
In addition to vaccines, are there other services that you want to make sure adults who may be watching now know you offer?
Cancer screening is obviously a big thing. And I think people are afraid a lot about getting a colonoscopy, so they don't want to come to the doctor.
Yeah, I've had one.
Yeah, they don't want to come to the doctor to talk about colon cancer screening. We offer something called fecal occult blood testing cards, and those are 3 cards they take home. They just do a little stool sample and then bring them back to the clinic. It's as easy as that. If it's negative, we let them go for another year. If it's positive, we go ahead and send them on for the colonoscopy.
What's involved in a cancer screening?
So basically, there's a few different types of cancer screening for men and for women. For women, obviously, is the pap smear. And many people are behind on their pap smear. Some are not as behind as they think, because we really want the pap smear every 3 years now. So,
When should you start getting them?
age 21.
Until, is there a cutoff
Like
point?
65-ish. It depends on the individual patient, but yeah.
Okay.
So,
How about dental care? I know dental care is a big one.
We offer dental care also on a sliding scale through OneWorld, and a lot of people don't realize that. Dental care is so important, especially for people who have other chronic diseases, diabetes.
Well, I saw on one of the slides there, cardiovascular disease. I often think about that and the relationship to dental health.
Exactly, yeah. We do recommend cholesterol screening for adults. I don't know if you guys have heard all the studies that more adults have prediabetes and diabetes. Many people are living with diabetes and prediabetes and don't even realize it.
I heard some crazy stat that many people, pre-diabetes, diabetes, the number of the people that fall into those 2 categories is like 40-some%.
Yeah,
it's
and
a high
I believe
number.
it. Yeah, I believe it. So it's an easy thing to come in and get screened for a diabetic check. It's as ezy as a finger poke to get that
When you
done.
say the sliding scale, because that was at the top of the list of why people don't come in, the financial part of it. So what do you evaluate, and what do patients need to bring in so that you can determine what they owe?
Right. So they would bring in their financial paperwork. So that could be like their pay stubs, a W-2, whatever type of income information they have if they have a job. And then our front desk kind of works with them, puts them on a scale. And like I said, it can be as low as $35 for a visit. And that would include these vaccines and these lab tests.
All right, let's talk about locations. 'Cause
Yeah.
It's not just one location. There are clinics
many.
around the area. And we've got a graphic here that kind of shows where they're at. Where are these locations at? You
Yeah, and I personally am everywhere.
You hit them all? You hit all the clinics?
Not all of them, but I split my time between our South Omaha location, which we actually have 3 buildings at the South Omaha. So we have the Livestock Exchange. In front of that, we have our Quick Sick, and I know people have come from Quick Sick, and then our Women's Center, and I think you've had some of my midwife team partners. I'm also on the midwife team. So
Oh, okay.
I split my time between the Women's Health Center and our West Omaha clinic, which is really close to here, 120th and I.
So everything we've covered today, as we're talking about vaccines and preventative care, all of this, really you could go to any one of the locations, right?
Yeah, and we have a clinic in Plattsmouth and also in Northwest Omaha near 90th and 4th.
And
Yeah.
I'm sorry, go ahead.
Yeah, and then we're opening one soon in Bellevue as well.
Oh,
so
into the south.
we're
And
going to
the
be
Quick Sick-
everywhere.
The Quick Sick location is basically, it's an urgent care is what
Right.
it is.
Yeah, so that'd be a little different. They wouldn't do as much of the preventative care at the Quick Sick location, but many times when the Quick Sick PAs are looking at a patient, they see if they're behind, and then they set them up in with a clinic visit as well.
OneWorld is all about access. We
Right.
see it with the number of locations, with the sliding fee scale, with the number of services, the variety offered. It really, it's about community health and every
Right.
aspect of it.
Right.
Online, we encourage you to go to oneworldomaha.org if you'd like to learn more about all of those satellite locations, services, and the rest. But point is, take care of yourselves.
Get in
Life's
for that
precious.
annual exam, right, doctor?
That's correct,
Yeah.
yeah.
Thank you. It's nice to meet
Yeah,
you.
nice to meet you guys
good
as
to
well.
see
Thank you.
I guess in the morning blend.